Good evening, sir. We have a consult from neuro department for you. Patient is HBV positive. This hepatitis B serology is very confusing for me, sir. Is there any simple hack to remember it?
There are 6 golden rules that you have to look for before interpreting hepatitis B virus serology. Rule number 1, surface antigen is always a marker of infection. If surface antigen is positive, patient is definitely infected. If surface antigen is negative, it doesn't really mean patient is not infected though. Rule number 2, anti-HBC is always a marker of exposure. IgM fraction is a marker of recent exposure and IgG fraction is a marker of remote exposure. And anti-HBs is a marker of immunity and it is the only protective antibody against hepatitis B virus. And rule number 4, E antigen is a marker of infectivity, not infection. If E antigen is positive, the patient is highly infectious. That's what you need to know. And HBV DNA is a marker of replication. In fact, in chronic HBV infections, the one thing that's going to correlate with the complications of hepatitis B virus is going to be the HBV DNA. And the final golden rule is the fact that whenever antigen is positive, antibody is going to be negative. And whenever antibody is positive, antigen will be negative. They are mutually exclusive. Both can be negative in a patient, but both can never be positive in a patient. And by the way, do you know that you just need surface antigen and anti-HBC plus or minus anti-HBs to make a diagnosis of HBV serology?
Really, sir? Is only 2 parameters enough? Can you explain?
I cannot explain everything in a single drill. You have to wait for the part 2. But before that, you along with the viewers who are watching this video should be able to answer this question as well. Beyond how many months, if surface antigen is persisting, you're going to define a chronic HBV infection? Mention your answers in the comments below.